Okay, well now we're going to show you the procedure for squeezing out the saliva. It's very important that the saliva swab on the stick is completely saturated in saliva. As we've shown you in part 2, the swab is very firm when it comes out of the packaging. It has to be completely saturated in saliva, and that will take 20 to 30 seconds, and when it's saturated it goes completely soft and squishy. It should still be adherent on the central core, but they should be able to feel that central core of plastic on their tongue, and if it's not completely squishy, they've not adequately saturated it into saliva. So the procedure is simply to push the saliva swab down into the base, and that discharges saliva, and if you squeeze it a couple of times, if you can see there, it's collected almost at least halfway up the tube is completely full of saliva there. So that is your saliva collected. The swab on a stick can now be put back into its tube and thrown away. Now to run the test, we're going to show you the procedure here. Clip the lid back on, unscrew the lid, and you are, by squeezing the base tube where you've got the saliva, putting 3 drops of saliva in each of the sample wells. And at this stage you start your timer so that you've got accurate read times for interpretation of your results. So now we're just going to leave that test membrane to run. You can just start to see the pink dye starting to appear in the test windows and osmotically travel up towards the top of that test cassette. We're going to switch this video off now and show you the results at the correct read time for the test.